Individual traveled outside Yukon, within Canada, and returned. The person is thankfully doing well with mild symptoms and is in self-isolation. The test result was received 48 hours after the swab was taken, so we are encouraged to see these new turnaround times. This is all the detail I can give you at this time, as we literally just received the result. I know we all need to digest that information for a while, but I can assure you that case investigation and contact tracing is now underway. And to state again, this is a case associated with travel outside Yukon. As this is associated with travel in Canada, it also speaks to the critical importance of adhering to the measures that we have previously announced. Self-isolation for any returning travelers or visitors coming back to Yukon, whether returning from international or domestic destinations. Vigilant self-monitoring for those people who are deemed essential and need to work and who would otherwise be in self-isolation. And adherence to the general population social spacing measures, social distancing, to limit spread of COVID when cases occur. I'm just going to reiterate a little bit of that in French. J'aimerais aller dire, nous avons identifié un troisième cas au Yukon ce matin. L'individuel a voyagé à l'extérieur du Yukon et est revenu. Heureusement, l'individuel se porte bien avec des symptômes légers et elle est l'individuel est dans un état d'isolation. Il est très important d'emphasiser que le résultat du test a été reçu 48 heures après le prélèvement et nous sommes donc très encouragés. C'est tous les détails que je peux vous donner à ce moment, car nous venons de recevoir le résultat. L'enquête sur le cas, la recherche de contact est en cours et pour répéter, il s'agit d'un cas associé avec des voyages à l'extérieur du Yukon. Et comme cela est associé avec un voyage au Canada, cela témoigne également l'importance cruciale du respect des mesures que nous avons annoncées. I'm going to review the other announcements here that were released today, and then I'll go back to some general comments. COVID-19 cases and test results. So as noted as of today, we have 3 cases now identified of COVID-19 in Yukon. And information is being published regularly now on yukon.ca and the coronavirus section, including pending test results, negative test results, and positive test results. The other important announcement for today is from the hospital, and I'm being the conduit for that information, that Yukon hospitals are suspending non-urgent or routine services as of Thursday. And this includes blood work and lab tests, x-rays, CT scans, and other imaging services, physiotherapy, and occupational therapy and specialist appointments. Of course, urgent emergency care will continue to be provided, but if it's a non-urgent service, treatment or exam, Yukoners are asked not to go to hospital. And again, these measures are additional measures to help the hospitals ensure capacity to respond to needs of the pandemic or potential needs of the pandemic, and ensure that really only those who crucially need to be in hospital are in hospital. And they also help to support the social measures to stop the spread of COVID or to limit the spread, practicing physical distancing from each other. I'm going to just repeat that hospital part in French. les hôpitaux de Yukon suspendent tous les services non urgents ou de routine à partir de demain, jeudi 26 mars. Cela comprend des analyses de sang, des tests de laboratoire, des radiographes, des autres services similaires. Les Yukonais, donc, ne devraient pas se rendre à l'hôpital pour un service non essentiel, non urgent. Et ces mesures sont prises pour aider l'hôpital d'assurer la capacité de répondre aux besoins de la population en cas de cas de COVID et aussi d'être commensurate, d'être d'accord avec la pratique de distance physique entre un à l'autre. On healthcare insurance, and again, I'm a conduit for the assurance from the government of Yukon that healthcare insurance plan will be extended to cover Yukon residents who are not able to return to the territory because of COVID. The usual requirement to be resident in Yukon for at least 180 days will be waived. And the Respiratory Assessment Center is now in its third day of opening, and it's again a reminder. It's open from 10 to 4. The first 2 hours being open for those older individuals, and this is what we might call a guided drop-in center. It's not a walk-in clinic. You need to be referred either through the 811 system, which has a telephone tree that is now a local telephone tree that will guide you through the steps that will help you decide if you need to go to the 811 to the respiratory assessment center or not. Referral can also be from Family Physician's Office, from YCDC, or from Hospital Emergency Department. So you may be diverted from the hospital department and asked to go to the respiratory assessment clinic. And then there are some messages about self-isolation on the announcement that I won't reiterate because I'll be going into them later. Donc, il y a une annonce pour la continuation de l'assurance soins de santé pour les résidents du Yukon qui ne peuvent pas retourner à ce moment. Et aussi, le centre d'évaluation respiratoire est maintenant ouvert depuis lundi et reçoivent les patients avec une référence. Donc, pour téléphoner la ligne 811 ou une référence de la salle d'urgence du centre de Yukon Communicable Disease Control ou de référence d'un médecin de famille. Thank you. And a few comments now. There have been many comments about whether, at this point, we've gone too far or not far enough, and are we bending the curve yet? And we're fortunate here that there is no curve to bend as yet. So the question is whether we're in a good position to bend the curve. And if we continue to maintain and improve social spacing and adhere to self-isolation, then we do have a very good chance to bend that curve. By active case finding, public health contact tracing, we can delay community transmission as long as possible and quite possibly prevent it. But even if we can't stop community transmission, we can certainly slow it down and break it up into pieces. And by the measures we have put into place, we almost certainly will. Due to different patterns of COVID increasing in different parts of the country, the timing and the approach to these measures that we're taking is not going to be the same time in the same place for every part of the country. But we all share the same goals, and we're always in active conversation with each other. Our goals, again, are to protect our communities and our vulnerable populations, to delay and limit the spread of COVID, and to protect the impact on our healthcare system. You can describe a pandemic not so much as one big outbreak, but as multiple outbreaks, some massive, some small, occurring in multiple parts of the world. And that's what's happening if we look at Canada. Even within provinces, that's the pattern we see. Not widespread disease all over the place, but multiple outbreaks in various phases. So if we can break the cycle, break the chain of transmission, we can still affect the epidemic profoundly. And to those who are calling for more, border closures, lockdown, shutting everything down, war measures, I warn you that we could make things much worse. Let's not underestimate the effects of shutting down, even to the extent that we already have. And let's not pretend that, similar to wartime, we will not already be facing the potential for months to years of recovery ahead. Seeing the epidemic move closer is scary, but if you're doing what you need to do for now, social spacing, having a reasonable supply of essentials, doing social isolation when you're required to, this is our greatest weapon for this war. Let fear not inform our response to this epidemic. A calm, careful, evidence-based approach is the better guide to both, all the while informed by revised guidelines as the science and understanding of this epidemic evolves. And in doing so, taking care of each other has never been as important. To protect our collective mental health, be kind to people, look after each other. And if you're getting stressed by COVID, take a COVID day off. Just maybe tune into the news and the website once a day instead of feeling the need to catch the latest numbers, the latest analysis, the latest update. I'll say a little bit of that in French. Voir l'épidémie se rapprocher, ça peut nous donner la peur, mais si vous faites ce que vous devez faire à ce moment, pour l'instant, l'espacement social, avoir un approvisionnement raisonnable des éléments essentiels, faire de l'isolement, faire de la quarantaine quand vous en avez besoin, ben, c'est notre plus grande arme pour cette guerre. Une approche calme, prudente, fondée sur l'évidence est le meilleur guide. Et en se faisant prendre soin les uns de l'autre. Et l'importance de ça n'était jamais aussi important que maintenant. Pour protéger notre santé mentale collective, soyez gentils avec les gens, prenez soin les uns des autres. Et si vous êtes stressé par COVID, prenez un jour de congé, connectez-vous simplement une fois par jour peut-être, au lieu de plusieurs fois. And for some suggestions, here are all the positive things you can do while observing social distancing, or what I prefer to call social spacing. You can work at home if your work requirements allow for that. You can still meet, talk, joke, even eat together if you observe social spacing. You can connect by social media. You can get outside and play. You can run, ski, or exercise. All of these things while observing correct social distancing. Even in isolation, in self-isolation, here are all the positive things. You can still work from home if your work requirements allow for that. You can still connect with others with an adequate space distance. You can enjoy all those movies you've been meaning to watch, or catch up on books, podcasts, tapes. Try writing a real letter to someone. Play music, take up a new skill. But self-isolation is no joke. You cannot go grocery shopping. You cannot mingle. You cannot share a bathroom. I thought it would be a good time to go briefly back to a theme I've talked about now and then over the years, how to keep well-being. And one of my favorite shortcuts to this is remembering the steps that were formulated through the UK New Economics Foundation a decade ago. And these principles are connect, be active, take notice, keep learning, and give. So connect is being social, whether it be friends, colleagues, or neighbors. Be active, so even with closures, and this need to keep track of COVID and the measures that we're advised to, it's easy to lose those habits of being physically active. So we need to find new ways and different ways of maintaining physical activity. We're all taking notice of COVID, but there are still other things out there to appreciate and keep track of. Remember to be curious and mindful and savor small pleasures and moments. And keep learning, where many of us unexpectedly thrown out of schedule or having unexpectedly more time. We need to keep our brains active, and this could be a really good time to learn a new skill or pick up an old one. And give. What's more important than now to give? It feels so positive and so good to do something nice for a stranger, to volunteer your time, see yourself linked to the wider community, even if that link is less visible than it usually is. And helping others in self-isolation is a really present example. Many communities and individuals have already organized to help people who can't go shopping. There are still volunteer opportunities. We may need to be a little bit more creative, but there are many that definitely still exist. And there are also small ways, just saying thank you to someone, just asking someone how they are, checking up on somebody. Maybe that would involve a phone call or a safely distant chat, or just a kind word or two, or a smile. And remember that there are local supports available for those feeling anxious and unsure in these times. Reach out to Mental Wellness and Substance Use Unit for support. The Yukon branch of the Canadian Mental Health Association is also offering support via phone. There are many helplines available locally and nationally. Many of our private counsellors in town are still providing services virtually or by phone. And remember the importance of reaching out to family and friends by phone or FaceTime. I know I've spoken quite a lot. I think I'll save the rest of the French for a question period, and I'm happy to pass over for comments to the Minister Frost. Thank you.
Thank you. Good morning, everyone. Thank you to you, Dr. Hanley and Dr. Elliott, and the entire team working with you. Your tireless effort and the work that you're doing 24 hours a day managing this response is very much appreciated by all Yukoners. COVID-19 has gripped the globe. Yukon is not immune to the impacts. Our territory is fortunate to have such a solid medical team working with us to keep us all safe. Now is the time for all Yukoners to take this situation very seriously. We must all work together to combat the possible impacts of the spreading of this virus. I know that we're all emotional at this time. Community members are calling. We have businesses calling, all extremely emotional, and just urge you all to please be patient with one another and work together. Now is the time for all Yukoners to take this situation very seriously. It's important that we put all our energy into protecting our communities, our vulnerable people, and our elders. To the citizens of the smaller Yukon communities, I can't urge you enough to please stay home and self-isolate. If you are returning home from outside the community or outside of the territory, be mindful of those around you and be mindful of the symptoms and do the self-assessment. To do this properly, you must stay in your homes and avoid contact with others for a full 14 days. Do not carpool to the airport. Do not stop for groceries on the way home. Do not go to a friend's for dinner. You must stay home and monitor your symptoms. The only people who are exempt from this precaution are healthcare providers upon whom our communities rely. These people have been asked to return to work if they do not have symptoms and to self-monitor daily to ensure they are healthy and can continue to provide essential services they provide. I'd like to take a moment to acknowledge the retired nurses, the doctors, and the health professionals that have stepped up and provided the services now more than ever to say, we're here if you need us. Thank you to all of you. So for those of us who have not traveled recently, it's also important for us all to play a very important role in practicing physical distancing. Wash your hands regularly, avoid any contact and all unnecessary contact with others. I appreciate that these are very difficult times to take. We want to gather, we want to love one another during stressful times. But if we truly want to work together to stop the rapid spread of COVID-19, we must take extreme measures, and now more than ever. Do it for your friends. Do it for the frontline workers who need to continue to do their jobs. Do it for our most vulnerable, and do this for your community. I also want to take a moment today to acknowledge the healthcare workers and the frontline staff working through this pandemic. Every day, Yukon nurses, doctors, pharmacists are working to take care of us. Beyond that, we're seeing a new definition of frontline worker emerge. We are seeing courage, patience, and dedication of our cashiers, our mail carriers, our daycare providers, and many more. These are the people who leave their families every day to come to work so that we can continue to access important services during this unprecedented time. I want to extend a profound thank you to all of them. For Yukoners concerned about access to your social assistance support, please know we are working to contact you to learn how you would like to receive your checks. We can mail them to you if that meets your needs. If you want to pick them up, we can arrange that too. Or if you want to designate a person to come and access and pick up your checks for you, please let us know, identify who the individual is, and they won't be required to provide an ID. Some clients have signed up for direct deposit. These people will continue to receive their social assistance funding that way. I know there are many in our community that are currently impacted by COVID. We have set up resources, we have supports in place. I encourage you to contact us. Our health and social services team are working very hard to support Yukoners. We are encouraging and supporting all staff who can work from home to do so, especially if they have any conditions that may make them vulnerable. As Dr. Hanley discussed, the government is extending the healthcare insurance plan to cover Yukoners who are not able to return home. The usual 180-day residency requirement is being waived, so Yukoners can rest assured they are still covered if returning home is not possible due to the pandemic restrictions. For Yukon public servants who do not need to come to work, our government is putting in place precautionary measures to keep Yukoners and the dedicated people who serve Yukoners as safe as possible. Yukoners, please show compassion to your neighbors. Be kind to each other. Keep each other safe and follow the guidelines of the Chief Medical Officer of Health. Stay home if you are sick. Self-isolate if you have traveled, and practice physical and social distancing. We are all in this together. though we must be together in spirit and apart in physical space. Wherever you travel, may you be guided and you be safe. Masicho.
Hi, Tim Kacharik, CKRW. This week, a letter was sent from early childhood educators to the Department of Health and Social Services looking for guidance. I know you, Dr. Hanley, have said, you're keeping daycares open because they're part of an essential service. But in the letter, they say, well, they're looking for direction. They're even looking for direction on how to social distance in daycares themselves. Even with reductions, they're wondering, and more toward Minister Frost, how are they going to keep the doors open? How are they still going to be funded? Can you speak to them on giving them direction on what they should be doing at this time? Are you willing to, as we get here, the situation is as per Minister Frost's comments here, take this very seriously. Are you, willing to kind of pull the plug on daycares now?
Yeah, absolutely. And again, this is a critical area where we need to strike that right balance between protecting children not just from COVID, but protecting children who otherwise need care in these circumstances and need organized daycare. And the guidance that has been very rapidly developed in coordination with Family and Children's Services has been to strive to reach that right balance, providing essential child care while providing also guidance on realistic social spacing. Of course, you can't ask 2-year-olds to space themselves 6 feet apart or 2 meters. But for instance, childcare staff in small groups of 2 to 5 with a single educator is a realistic way of providing reasonable and common sense social spacing. And that's the main method to reduce infection, teaching staff to teach children as well. Recognizing that social spacing is not always easy or realistic, but again, achieving that right balance for where we are in our stage of the epidemic is critically important. There is always a lag between developing the guidance in a rapid way, making sure that it's organized well with the organizing bodies, and then getting that to every daycare. But I can tell you those conversations are intensely happening today and over the days to come.
And Minister Frost, about the financial aspects?
Okay, so we had a really great call with the day homes and the childcare centers yesterday. I just want to, extend my appreciation to all of them for stepping forward, and we hear the concerns that are being raised by that the group of daycare workers, and I know they're going above and beyond, and they are also concerned. We heard their concerns. We had staff on the call yesterday speaking to them about how they can direct access the funding, assuring them that there will be no disruption in the direct operating grant. They will continue to get the funding. We will ensure that they are supported, and they have been given a direct contact to work with our health officials so that we don't see any disruption in services. Thank you.
Hi, Gabrielle with The Star. We're seeing city buses are still full in the morning when people are on their morning commute. Is there a way to make sure that essential workers who have to use public transit can do so safely?
Yeah, there certainly should be a way, and any public transit, of course, public transit can be critical in a time like this, but that too should adhere to the social spacing requirements. So maybe that's a good flag to work with the city to make sure that that transit can still occur while social spacing is adhered to.
First we have Chris from CBC.
Hi, we're going to the landline now. Chris with CBC, you're up first, please. Go ahead with your question, CBC. Okay, we're going to move to Radio Canada.
L'aurore boréale qui a une question. Hi.
Hi, stand by. We're going to go
Hi,
with...
this is Mugali Samba with...
Excuse me.
Okay,
Hello?
everyone, let's just take a pause. Okay, we're going to go back to CBC, and then after CBC, we'll go with Radio Canada, and then we'll go APTN, and then Aurore Boreale. So we'll start with CBC.
Yeah.
Okay, sorry about that. Just with the first two cases announced on Sunday, it was mentioned these folks returned to Whitehorse. They did all the right things in terms of self-isolation. Can you speak about this third case, whether they've only stayed in Whitehorse and whether they have done all the right things in terms of self-isolation?
Chris, I don't, as I said, the case, the news of the case just came to us today. The swab was taken 2 days ago, the result today. And what I do know is that the person adhered to social isolation at the time of testing. And the rest of the details are actively being worked on at the time being.
Okay, thank you.
Thank you. We'll go to Radio Canada.
Hi, I was just wondering whether Yukon was considering closing its borders in a similar way as the Northwest Territories had done recently, and if I could also
Sorry, I couldn't understand. Do you mind repeating it?
Sorry, would you
I
mind?
was wondering.
Go ahead.
I just wanted to know whether the Yukon was considering closing its borders to inbound travel by air, land, and port in a similar fashion to the Northwestern Territories.
The question is about closing. Are we considering closing borders similar to the other territories? And as I said earlier, in general reference to increasing measures, no, not at this point, but we're actively looking at potential next steps. So again, we are under different circumstances than the other territories. We have, and we're very conscious of what are the implications of such a pronouncement for, again, trying to maintain that right balance of maintaining our society as best as we can, maintaining the economy of our society as best we can. So we are, with the help of our colleagues in emergency measures and all across government, looking at potential next steps should we need to go there. How would we do that? How would we operate? Rather than going too fast, too soon.
Okay, we'll go to our next media outlet, APTN. Go ahead, APTN.
Hi there. I have two questions. Recommendations were given to work from home, but does HR have a protocol with healthcare workers should stay working in the hospital or working from home? And you mentioned that you want to protect communities, but you don't say which community the outbreak is coming from, and it's standard practice. But how is that protecting the community if they don't know that COVID is in their community?
Just ask you to repeat it one more time, just to make sure we understand that clearly, in particular for interpretation. Please repeat it.
Okay, I'll just ask my first question then. Recommendations we're giving to work from home, but does the hospital HR department have a protocol to determine which healthcare workers should be working from home and which healthcare workers should be staying on the front line?
I think the question is for healthcare workers about the process for determining which are essential and which, if I'm interpreting this right, it's how do we know which healthcare workers should continue to stay in self-isolation and which are considered essential to continuing the job and therefore can work with self-monitoring? Is that the question?
HR, you're telling people in the healthcare system to go home and work from home if you can. And I think a lot of them are getting the feedback from their HR department that everybody is treated equally here. So what does that mean? You stay home? Am I staying home? Do you stay home? So there's a little bit of maybe gray area that people aren't.
Okay, so maybe I'll try to cover all of those